Good morning. Welcome to the program. When it comes to permanent birth control, a woman is twice as likely as a man to have surgery. But female sterilization is much more complicated and dangerous than the comparable surgery in a man, that being a vasectomy. And what if I told you a vasectomy was done with no needle, no scalpel, and no pain? That's right. And it's happening here in Northwest Ohio. Today, we are joined with Dr. Puneet Sindhwani, who is the Chief of Male Infertility and Reproductive Health Services at University of Toledo Medical Center. We will discuss the no needle, no scalpel vasectomy. Please enjoy the show. Good morning. Thank you for joining us. Thank you for being here, Dr. Sindhwani.
Glad to be here.
And I was impressed with your information and your CV and your knowledge about the subject which we are going to discuss, which is a very delicate subject, let's put it that way. And I'm sure you already had that addressed many times.
Absolutely, yes. It's something which is probably most scary to most men.
Yes.
Knowing that vasectomy is the most effective way of contraception. Better than tubal ligation, better than contraceptive pills, least failure rate. Still, it's underutilized just because of that, because most men are afraid of the pain that's going to happen with the procedure, the injection they're going to get in that area.
Absolutely.
So you're right, delicate is the word.
Okay, so let's start immediately talking about that subject, which is you have that program, which is you are the only program, or University of Toledo has the only program, which is no needle, no scalps, basically vasectomy. So can you tell us a general idea, what's that program? What's the difference between that and the vasectomy, the standard one which we have around the nation?
Right, absolutely. So no needle, no scalpel vasectomy is relatively newer concept as compared to vasectomy. When vasectomy was being done, the evolution of the procedure happened that they did in China. When they did the mass vasectomies, they let go of the scalpel first. Yes. So you can do it through a puncture of the skin, deliver the vas, and then clip the vas or cauterize it or tie it and then drop it back. So that was the first improvement with no scalpel vasectomy.
Okay.
But then people saw that still the acceptance in men was not that high because they were afraid that they're going to get local anesthetic in the area with the needle injection, which was pretty painful.
Absolutely.
So then the next iteration of it came because you wanted no needle device. And this is a really interesting story because this is basically NASA developed this device, which is a high pressure jet spray. It was used for mass immunizations. It has no needle. It has very fine nanopores through which when you put a liquid under high pressure, it becomes, it atomizes it. So it becomes so fine, it can go through the skin, underlying structures, and sometimes up to the depth of a centimeter inside.
Okay. So by using that spray, technically you are applying some kind of anesthetic medicine, but without the needle.
Without the needle.
That's a simple way.
That's a simple, right.
Okay.
So that's how it works. So you have to roll the vas in a certain way so that the tube comes to next to the skin. And not only that, you have to roll it so that the part which is rich in nerves comes up first.
I see.
Now when you have it, then you fire this device and the spray goes in through and through, and those nerves are then desensitized. Okay. And basically you use 0.25 ml, which is the minuscule amount
Very
that
small.
you use. So it does not distort the anatomy, it doesn't cause hematoma, minimizes the trauma. After that, you just take a puncture device, you can do your procedure, drop it back in. We did actually study and we published in Canadian Urology Association Journal. Okay. And we looked at the men about the perception of the pain and what actually they were anticipating and what is actually pain felt during the procedure. We showed that their anticipation was 3 times worse than actual procedure pain.
Wow.
And on a scale of 1 to 10, we used a visual analog scale, and it showed that their average pain scale was 2.3, which they said was as bad as maybe flick of a finger, or some people described as ant bite, equivalent of an ant bite.
So based on this technology, how long is this procedure takes?
It takes us 5 minutes on each side.
5 minutes.
Because unlike needle anesthesia where you have to wait, here you don't have to wait. Once the spray is in and mist is in, because the fine structure diffuses and it causes right away anesthesia right away.
That's great. And what about the effectiveness? Since you did multiple studies, is the effectiveness of this technique the same, better, worse than the original idea of vasectomy?
So
Same.
The effectiveness of the vasectomy remained the same. The failure rate of vasectomy remains 4 in 1,000.
Okay.
So once again, it's really, really effective procedure.
And the success rate of the procedure is what?
So,
95%?
That'll be 99.996%.
So it's almost 100%.
Right, almost 100%.
Okay. So what is the possible risk of this procedure? I mean, even that it's very minimal, the way you are describing it, 5 minutes on each side. What's the possible risk of this procedure?
So most important thing to remember is anytime you operate in an area which has blood vessels around it,
Sure.
so formation of a hematoma, because it's a minimally invasive technique, everything is done through a 3 to 5 millimeter puncture.
Okay.
We let the nature takes care of the bleeding afterwards when things are just dropped back in. So it can stir up bleeding and collection of blood underneath. So that's a hematoma, which is typically self-limiting. You don't do anything, ice and rest is the way to go.
Okay.
So that's one of the things. Other is some people after vasectomy can have some pain which can be prolonged. In some people you have to make sure that they take appropriate rest and they don't do any heavy lifting or straining for a short period of time after the procedure.
So in general, for the procedure like that, what is the instruction for the patient? Like how long they're going to be off work? How long they have to lie down and not to do that much of activity? You know, some of us is exercising on a regular basis. I mean, so what is the specific instruction after the procedure?
So we always tailor make the instructions according to the patient's job. If you're doing desk job, you're okay to go back to work next day.
Sure.
If you're doing manual job, you may need an extra day of rest. So they can go back, but important thing is at that time we tell them to use a scrotal support. So make sure a tight athletic underwear or something that will make their less movement in the area.
Okay.
Well, they always tolerate it well. Otherwise, from that, there's no other precaution that we ask them to.
Okay. Now I'm going to expand a little bit on the subject. And the question about the vasectomy always comes, is it reversible?
Yes, excellent question. So during the initial consultation, when somebody comes to us seeking vasectomy, it is very important at that time to talk to them that unlike other options, this is considered permanent for all practical purposes. And there's a reason behind it. And the reason for that is in case life takes a turn, something happens and you want to have more kids. In that case, it requires another surgery to freshen the ends and bring the ends back together and reverse the vasectomy.
Okay.
It can be reversed, yes, absolutely. The success rate of reversal depends on multiple factors. It may not be 100%. You may still get sperms, but they may be bad quality. It depends on how long interval has taken place since your vasectomy. The longer you go from your vasectomy, the lesser the chances of having good quality sperms to be retrieved afterwards.
Absolutely. So in that case, what's your recommendation for the younger generation who they just don't want to have kids at this point? I mean, is it ideal to have the vasectomy, or they have to be sure that they are not going to have kids for long term?
That's a great question. And it's coming more and more common due to lifestyle choices. We see younger couples coming to us and saying, we just don't want any kids, and they have no kids.
Okay.
So how do you proceed? This is a young couple. Life may take a turn. Things may change. They may change their mind afterwards. So you always counsel them, not only at that point for considering other options,
Sure.
but also to cryopreserve, which means freeze the sperms ahead of time. So that in case this thing happens, all vasectomy patients at our practice, at UTMC, we have the facility that we can cryopreserve sperms ahead of time.
Okay.
So that this does not kind of throw them off later on.
That's great.
And they can cryopreserve, and then they want to proceed. And years later, if they want to come back and use their own stored specimen, they can have good success with that.
Absolutely. Now, bringing me to the cost of this procedure and insurance coverage, how is that working at this point?
We have not had any issues because the procedure code for the vasectomy is same, whether you're doing it no needle or whether you're doing it with needle, with scalpel, without scalpel. Good thing is because you're doing it in office, so it's just an office procedure copay. So it's not under ASC copay, which is higher, or surgery copay when some
In the
patients are
hospital.
getting over there in the hospital.
Absolutely. And what about the fertilization? I mean, if they want to freeze their sperm or anything like that, how does that work? Is it out of pocket, or there is some insurance coverage?
So it depends on your insurance plan. So you have to get pre-authorization. You have to make sure your insurance pays for it. In my experience, there are very few and far between insurances that will cover it for you. Okay. Most of the time, it's going to be your own expense. So you may have to, I forget the exact amount.
Sure.
I think it's $300 or $500. Absolutely. You have to give.
Now, if you want to give a message to the general public about vasectomy, I mean, this is the one which is many people, they are fearful of just hearing it. What can you tell them about how safe, how easy procedure, and if really someone interested to have this procedure done, that there is nothing to be concerned about?
Yeah, absolutely. So one thing that people need to know, that of all the available contraception options, vasectomy is most effective. Yep. Better than tubal ligation, better than contraception, better than barrier contraception, sure. Pills, and it has the highest success rate with minimal amount of complications. Absolutely. Much lesser complications than tubal ligation, where you're going actually in the abdominal cavity, yep. So there's higher chance of injury. The complication rate is 1%, whereas with vasectomy, the major complication rate is 1 in 10,000. Wow. So it's really, really rare where you have to go back to surgery to get something done.
Now, if there's any difference between the type of patient, like I'm going to throw this example, if there is an obese individual, overweight versus an average person, I mean, is the complication rate the same, or there is some other comorbid factor which is we have to put in consideration?
Right. So typically, you'll be surprised that the scrotal skin is not affected by obesity as much, because it stays thin, because nature has a mechanism by which your thermoregulation is still to be maintained to have good quality sperm production. So other conditions, however, can complicate vasectomy. For example, there's a certain anatomy called shawl scrotum in which you may not be a candidate for this. Okay. A person who has had previous injury, trauma, or scarring so bad that the skin is scarred up and that you cannot reach the vas. Sure. So those are the patients probably you cannot do a vasectomy without giving them general anesthetic. Very rare, happens maybe once or twice a year that you run into this kind of patient population.
Does the number of procedure done by the surgeon play a role in their experience?
Absolutely. Like any skill that you have as surgeon, as a procedurist, you probably know, the more you do, the more variations you have seen, yeah. And the more comfortable you get. And by doing that, your complication rate goes down, or your success rate goes up. Is there a formal study? I have not seen any that people have looked at it, but it's a great idea to probably go back and look
Absolutely.
At it. Yeah.
Absolutely. So after this procedure is done, most common fear I think every man has is possible erectile dysfunction, or his sexual drive is not going to be the same. Can you elaborate on that subject in more details?
Absolutely, and you're right, this is probably most common fear, unspoken fear. Yep. That's why men don't come forward, because they think for some reason they're going to have problems with the sexual function, or they're going to have problems with satisfaction. Mm-hmm. And there are studies after studies that have shown this is not true. Okay. The mechanism of fertility and mechanism of sexual function is totally unrelated. Okay. Sexual function is more related to actually your cardiovascular status. Mm-hmm. The new term for ED is now endothelial dysfunction rather than erectile dysfunction. Absolutely. So probably nobody knows that better than you. And so it's more of a vascular neurogenic phenomena, whereas the fertility and the vasectomy part that we do is a totally causing obstruction of the vas so that the sperms don't flow through, and they're not related at all.
Okay, what about the hormonal changes? I mean, if there's any hormonal changes with the procedure-related outcome?
Once again, great question, because patients ask us all the time, am I going to feel less of a drive? Is my libido going to go down? Mm-hmm. And the short answer is no. There were studies that were done in stable couples. They looked at their satisfaction scores before the vasectomy and then after the vasectomy. Sure. And it showed that there was less anxiety of having unplanned pregnancies. So there was more satisfaction in the couples who have had vasectomy as compared to couples who did not. So if anything, they were more engaged and they were more satisfied after the procedure, no hormonal consequences at all.
Great. If there's any age limitation for this procedure?
No, the society is changing. We do see couples who are coming in late. We do see couples where the male partner may be elderly, but they still have a female partner where there's a potential that they can make them pregnant. So there's no age limit.
No age limitation. That's great. We really appreciate all of the information and the input about this subject, and I hope we introduced enough information to the public to visit you and visit the only center we have in Toledo with the no needle, no scalp, basically vasectomy, and we wish you the best of luck.
Thank you so much. I appreciate your time.